It's Ed back with you and my friend Shailu. Shailu, welcome to your own series, limited series on Mila Health.
Thank you, Ed. Looking forward to it.
Yeah, this is episode 3. So just to remind everyone, episode 1, we covered your background, sort of your history, your career, and things that led you to where you are today in terms of starting Mila Health. The second episode, we kind of went through the origin story, like why, why do we need this product? What's the problem that you're solving? And so in this episode, episode 3, we're going to talk about building out the team, building out the product. And then episode 4, just a teaser for everyone, we're going to talk about results because we've been doing this series through several months. And so we're able to sort of track everything from the beginning all the way to current state and actual results. So yeah, let's talk about it. So what have you been doing? Let's talk about the team first, and then we'll get into the product. But you obviously can't do this alone.
Yeah, and the team it's I built one company before Mila, and what I realized in that process is that there are lots of ups and downs in the journey. It's never a straight line. And of course, you want the best folks because you're doing something that is really hard to do. It was super simple to do. Anybody could do it. So in the context of A, the skills, and B, your ability to work with them and their ability to work with you and go through the ups and downs that it takes to build a company from scratch. It looks awesome on the outside, but believe me, Ed, there are days where we're like, okay, this is super, super hard, right? So the team was one of the most important things for me, besides, of course, the problem statement and my customers. And so I had been thinking about the team for a very long time. So I'd been thinking of my next company and who I would work with for a very long time. And the people that I have on the team are folks that I've worked with for almost 10 years in some cases, 15 years in some cases, some slightly less. And they became the core part of who Mila Health is. So for example, my chief technology officer and my chief product officer is Dr. Vasant Manohar, who's a PhD in computer science. He was my engineering counterpart at AWS, where we went through lots of ups and downs to launch many, many products. My co-founder is Ranju Das, who was my colleague at AWS again, and with me at UHG. Dr. Iran Halperin runs our AI in Mila Health, and he was Senior Vice President of AI in Optum and UHG. So these are folks that have worked with each other, know each other, and we have confidence that, hey, we'll go through this journey together with ups and downs. So that's kind of how I've been thinking and working on the team. It's a long journey, and it's a very
Yeah,
important.
that's always the best. I mean, even when it's not a startup, even when you're an executive like yourself in other organizations, whenever you can work with someone who's you have a trusted relationship with already, kind of know the pros and cons, that's always the best, especially with a startup. It would be hard to just pick someone random and then you're never really sure, even though we might be really good at interviewing and things like that, you really never know, especially with a startup, because as you mentioned, it's not like a linear thing. It's very up and down. And so you have to have someone who's sort of wired that way and has that experience with you. So let's turn to the product. So tell us about sort of the building out of the product. Because again, when we first talked, it was a concept and then you started building and you have demos and those sort of things. Just tell us how that sort of process has gone.
Awesome. So I'll talk to you about the product and the process since they're slightly different things. So the product, as I mentioned early on in my videos, Mila is an AI healthcare worker. And the problem that we are solving for is today, when it comes to helping a patient or a provider-patient connectivity, it is largely all done manually, where I'll communicate with you, Ed, and say, hey, I need you to prepare for a colonoscopy. So the guiding of diet, the medication, the logistics of the appointment, these are all manual outreach, if that even happens, to guide
Yeah.
you through that process so that you're prepared for a colonoscopy, which I did a few months ago and was terrible. Or if I'm a chronic care patient, I have somebody from the office calling me to check on my medication, check on whether my weight is tracking right, check on my symptoms, whether I'm shortness of breath so that I don't go back to the hospital and become an emergency issue. All of these processes today, Ed, are all manual. And so we've built Mila as an AI worker that can extend a physician's team. Mila comes pre-trained on a bunch of tasks. So you can tell Mila, go prepare Ed for his colonoscopy, and Mila will do that. Or Mila can be tuned to what the physician wants Mila to do. And physician can also train Mila into doing new tasks. So Mila is essentially designed as an AI worker that can text, can get on the phone any time of day and night, speak in any language, speak to really anybody, and guide them through their healthcare plan so that they are able to adhere to the healthcare plan better. And they are able to get to a physician when they need to. So the physician gets helped because they can see their patients in the right way and build the right way. And of course, the patients get help in a better health outcome. That is the essence of the product.
No, I love it. And I know it's not just limited to colonoscopy, although that's an example. I just recently went through mine as well. I guess we're both in that age group. And yeah, I would have loved to have an agent like Mila Health walking through that. It would have saved so much time and so much hassle. So I love it. In fact, for episode 5, we should do a demo for everyone since we're talking so much about it.
Love
So,
it.
so that's a
Absolutely.
little teaser. So thank you for watching episode 3. Episode 4, we'll talk about results, early results. And then episode 5, we'll actually do a demo.